Is your fatigue a hidden warning? 15 cancer signs you can't ignore. Cancer is on the rise at an alarming pace, affecting more people than ever before. But the real question is, if your body started signaling something important, would you be able to recognize the signs? Welcome to Healthy Every Day, where we bring you science-backed health insights to help you stay ahead of serious health risks. Every year, millions of people are diagnosed with cancer, and those numbers are continually climbing. Some forms, like pancreatic or brain cancer, often remain undetected until it's too late. But here's the truth. Early detection could make all the difference between life and death. Spotting warning signs before cancer advances can dramatically increase your chances of successful treatment. Now, what you're thinking, does every little symptom mean cancer? And when I search online, find too much conflicting information. That's exactly why this video is different. We're cutting through the fear and the misinformation, offering you scientifically proven warning signs that have helped thousands of people detect cancer early, when it's most treatable. Your health is far too important to overlook. Be sure to subscribe to Healthy Every Day. Pay attention to your body, and together, let's explore the 15 crucial signs that could save your life. Sign number 15. Persistent fever. Persistent or recurring fever that doesn't seem to have a clear cause could be your body's way of signaling blood cancer. Unlike typical fevers that resolve within a few days, cancer-related fevers often follow a distinct pattern and may come with other systemic symptoms. For instance, leukemia and lymphoma can trigger your immune system to release chemicals called cytokines, which lead to frequent fever episodes. These fevers might appear without an infection and often come with other signs like night sweats or unexplained weight loss. Some cancer-related fevers may follow a cyclical pattern, with temperature spikes occurring at regular intervals. If a fever persists beyond 2 weeks or recurs without a clear reason, it's essential to seek medical attention. Blood cancers can compromise your immune system, making you more vulnerable to infections, and they can cause fever directly. Proper evaluation often includes blood tests to check for abnormal cell counts and other disease markers. Sign number 14. Jaundice. Have you noticed your skin or the whites of your eyes turning yellow? This could be a sign of jaundice, which happens when bilirubin builds up in your body. While jaundice can occur due to various conditions, its sudden appearance in adults is often a red flag for pancreatic or liver cancer. In pancreatic cancer, a tumor may block the bile duct, preventing bilirubin from being properly processed. This backup of bile causes bilirubin to enter the bloodstream, turning the skin and the whites of the eyes yellow. The color change might start off subtle, but becomes more pronounced over time. Since the pancreas is located deep in your abdomen, early detection of cancer in this area can be tricky. Recognizing jaundice, especially when it's paired with upper abdominal pain, dark urine, or light-colored stools, is crucial. Sign number 13. New or unexplained pain. Are you experiencing pain that just won't go away, and you can't pinpoint the cause? Pain that doesn't have a clear reason, like an injury or illness, and doesn't respond to usual treatments, should be examined by a doctor. Pain is your body's way of telling you something's wrong, and if it persists without explanation, it could signal something more serious, like cancer. For instance, abdominal pain could be a warning sign for prostate, bladder, testicular, or penile cancer in men. For women, unusual pain or sensitivity in the breasts might indicate breast cancer. This type of pain isn't the usual discomfort, and it doesn't fade away with typical remedies, which might mean that something more serious is at play. Pain can also be a symptom of internal cancers that may not always be easily detectable. Certain types of cancer can manifest in subtle ways, like a persistent feeling of heaviness or swelling in the scrotum, which could indicate testicular cancer. Similarly, ongoing pain in the abdomen might be a sign of liver or pancreatic cancer. These pains are often dismissed or blamed on less severe conditions, but they deserve serious attention. Ignoring unexplained pain can be dangerous. It's easy to brush it off as a minor issue, but if the pain persists without a clear cause, it must be investigated. Sign number 12. Fingernail marks. Subungual melanoma. Have you noticed a strange dark line running along your nail? Subungual melanoma, a form of skin cancer that develops beneath the nails, often starts as an innocuous-looking streak. This dark line, medically known as melanonychia striata, what makes this condition particularly dangerous is how easily it can be confused with normal nail trauma or a fungal infection. Warning signs to watch for include a dark streak wider than 3 mm, variations in color within the streak, or blurred edges. Hutchinson sign refers to when the dark pigmentation extends beyond the nail onto the surrounding skin. If you notice any changes in your nails, particularly if they're accompanied by pain, splitting, or bleeding, don't wait to seek medical attention. Early recognition can sign number 11. Bone pain. One of the most commonly overlooked signs of potential cancer is persistent bone pain. Unlike the temporary discomfort you might feel after exercise or a minor injury, cancer-related bone pain often intensifies over time and can worsen at night. When cancer starts in the bones or spreads to them, it disrupts the bone tissue structure, leading to deep, persistent pain that's hard to ignore. Primary bone cancer, such as osteosarcoma, the pain may begin as something subtle, like a sprain or muscle ache, but over time, it becomes more severe and constant. What's particularly concerning is how it can interfere with daily activities, making simple movements increasingly difficult. Some patients describe the pain as throbbing or aching, and it often doesn't respond to typical pain relievers. If bone pain is accompanied by swelling, tenderness, or unexplained fractures, it's critical to seek medical attention immediately. Early detection of bone cancer improves treatment outcomes and significantly increases sign number 10. Eye pain. Your eyes can provide valuable insight into you might. Certain factors, like prolonged sun exposure or a family history of cancer, can increase your risk for certain types of cancer. But recognizing warning signs early can make all the difference in catching something before it becomes more serious. Sign number 9, excessive bruising. Have you noticed unexplained bruises showing up on your body? Excessive bruising, especially in unusual places, could be a sign of blood cancer. If bruises appear without any clear cause, it's important to consult a doctor. These bruises could indicate problems with your blood cells, such as leukemia. Leukemia affects the body's ability to produce healthy blood cells, leading to symptoms like easy bruising. These bruises can appear on your arms, legs, or other places where you might not expect them. In addition to bruising, you may also notice symptoms like frequent nosebleeds or bleeding gums, which could also be signs of blood disorders or cancers. If you experience any of these, it's essential to have them checked by a healthcare provider. Pay close attention to changes in your body, especially if you notice bruising happening frequently in unexpected places. Early detection is key, so don't wait to seek medical advice. Sign number 8. A cough or hoarseness that won't go away. Are you dealing with a cough that just won't go away? If you've been battling a persistent cough or hoarseness for more than 2 weeks, it's important to get it evaluated by a doctor. A dry, hacking cough that doesn't improve could be a sign of lung cancer. If you're coughing up blood or noticing bloody discharge, seek immediate medical attention. Hoarseness or a raspy voice that doesn't disappear could also be a warning sign. If you notice changes in your voice, especially if accompanied by difficulty swallowing or pain in your neck or throat, this could indicate thyroid or throat cancers. Often, persistent coughing and hoarseness are overlooked as minor issues, but when these symptoms last, they can be a sign of something more serious. Chronic coughing, particularly from lung cancer, doesn't respond to typical treatments. Listen to your body and consult a healthcare provider if these symptoms persist. Sign number 7, blood in the urine or stool. Seeing blood where it shouldn't be is always alarming. If you notice blood in your urine or stool, don't ignore it. Blood in the stool can appear as black, tarry, or bright red, while blood in the urine may look pink, red, or dark brown. These symptoms can be signs of serious conditions, including cancer. Blood in the stool could signal digestive system cancers, like colon or rectal cancer, or it may indicate inflammatory bowel disease or ulcerative colitis conditions that disrupt the normal functioning of your digestive tract. Similarly, blood in the urine may be a sign of prostate or bladder cancer, or it could be linked to urinary tract infections or other issues. The presence of blood is a red flag that something isn't right, and it needs to be evaluated by a healthcare professional immediately. Don't delay seeking medical advice if you notice blood in your urine or stool. Prompt evaluation can make a crucial difference in your health outcomes. Sign number 6. Mouth sores that won't heal. Have you noticed any sores in your mouth that just won't heal? If you have persistent mouth sores that last for weeks or keep recurring, it's time to pay attention. Mouth sores that don't heal or keep coming back could be a warning sign of oral cancer or other serious conditions. These sores might start as small ulcers or irritations and worsen over time, making it difficult to eat or speak comfortably. If you've had sores in your mouth for an extended period, especially if they're painful, swollen, or bleeding, it's important to see a healthcare provider. Early detection of mouth cancer can significantly improve the chances of successful treatment. Mouth sores that don't heal. If you have mouth sores that don't heal after a couple of weeks, it's essential to take them seriously. Persistent sores or white patches on your lips, tongue, gums, or anywhere else in your mouth should be checked by a doctor. These could be signs of oral cancer, which can develop in any part of the mouth, including the lips, tongue, and throat. If you use tobacco or drink alcohol heavily, you may be at higher risk for this type of cancer. It's important not to ignore mouth sores, especially if they're accompanied by other symptoms like difficulty swallowing or unexplained weight loss. White patches inside the mouth, known as leukoplakia, can also be a warning sign. Leukoplakia is a precancerous condition that can eventually turn into cancer if not treated. These patches might look harmless, but they need to be evaluated by a healthcare provider to determine the best course of action. Ignoring mouth sores can lead to severe consequences, as oral cancer can be aggressive. Early detection is crucial for successful treatment, so seek medical advice if your sores don't heal. Sign number 5. Persistent heartburn. Chronic heartburn, medically known as gastroesophageal reflux disease (GERD), might seem like a minor inconvenience, but when it persists despite lifestyle changes and medication, it could indicate a more serious issue. Esophageal cancer often starts as persistent acid reflux that doesn't respond to standard treatments. The link between chronic heartburn and cancer lies in the repeated damage to the lining of your esophagus. Over time, stomach acid can cause changes in these cells, leading to a condition called Barrett's esophagus, a precancerous state that significantly increases the risk of esophageal cancer. Watch for warning signs like difficulty swallowing, food getting stuck in your throat, or unexplained weight loss alongside your heartburn. If you've been treating heartburn with over-the-counter medications for more than 3 weeks without improvement, it's time to see a healthcare provider. Addressing these issues early is key to avoiding more serious conditions. In the next part of this video, we'll cover even more potential warning signs to help you stay ahead of serious health concerns. Sign number 4. Changes in urinary or bowel habits. Shave. You noticed any changes in your bathroom habits lately? Changes in urinary or bowel habits can be an early sign that something isn't right in your body. If you've been dealing with constipation or diarrhea that lasts for several weeks, it's time to see a doctor. While these symptoms might seem minor, they can point to serious underlying conditions, including cancer. Changes in bowel habits could indicate inflammatory bowel diseases like Crohn's disease, but they could also signal colon or stomach cancer. These cancers can disrupt your digestive system, causing noticeable changes in how often and how easily you go to the bathroom. Similarly, changes in urination, such as pain when urinating, increased frequency, or a weak stream, might point to urinary tract issues. These symptoms could indicate an enlarged prostate, a urinary tract infection, or, more seriously, prostate or bladder cancers. It's essential to get these changes checked out. While they may be caused by less serious conditions, they could also be early warning signs of cancer. It's always better to investigate and rule out serious issues than to ignore symptoms and risk letting a treatable condition worsen. Being proactive about your health means paying attention to the signals your body is sending you. Sign number 3. body rash when it comes to skin changes. Certain rashes deserve immediate medical attention. Leukemia, a cancer that affects the blood-forming tissues, can show up through distinctive skin symptoms that are often mistaken for minor issues. The key difference lies in how these rashes appear and behave. A telltale sign of leukemia is petechiae tiny, round spots on the skin caused by platelet deficiency, a common feature of leukemia. These spots typically range from 1 to 2 millimeters and don't fade or blanch when you press on them. They can be red, purple, or brown, and often cluster in areas where pressure is applied, such as on the ankles or around tight clothing. Understanding what causes these spots is crucial. Leukemia disrupts the body's ability to produce healthy platelets, which usually help prevent bleeding. Without enough platelets, tiny blood vessels, called capillaries, can leak, creating these characteristic spots. Unlike typical rashes that might itch or fade within a few days, leukemia-related rashes persist and may be accompanied by other symptoms, such as unexplained bruising or bleeding. Sign number 2. Persistent headache. You have a headache? That just won't go away? A headache that lingers despite taking over-the-counter or prescribed medications can be a red flag. If your headache lasts more than 2 weeks, it's time to see a doctor. Persistent headaches could signal something more serious, like a brain tumor or other brain cancers. Along with the headache, other neurological symptoms may appear, such as blurred or double vision, changes in hearing, or facial drooping. If you experience any of these symptoms along with a persistent headache, it's essential to get checked by a healthcare provider as soon as possible. Seizures or other unusual neurological events should also be evaluated immediately. These symptoms may indicate changes in the brain that need urgent attention. Brain tumors, for example, can press on nerves, disrupting normal brain function and causing these types of issues. While not all headaches are related to cancer, those that don't respond to typical treatments and last for an extended period should be thoroughly investigated. Early detection is critical for effectively treating brain tumors and other related conditions. Sign number 1. Persistent fatigue. Have you been feeling unusually tired lately? Persistent fatigue can often be one of the first signs that cancer is growing in your body. If you notice your energy levels dropping and no amount of rest seems to help, it's time to take this seriously. This isn't your typical tiredness from a busy day, it's a deep, relentless exhaustion that doesn't go away. Fatigue is particularly common in cancers like leukemia or lymphoma, which affect the blood and bone marrow, disrupting the body's ability to produce healthy blood cells. As a result, you may feel worn out no matter how much you sleep or rest. If this exhaustion persists, it's crucial to see a doctor to get to the root of the issue. No matter how much you try to rest, if you find yourself feeling constantly fatigued, it's time to pay attention. In addition to fatigue, you might also experience muscle weakness or confusion. These symptoms can be linked to cancers that affect hormone levels or cause internal bleeding, such as colon or stomach cancer. When cancer disrupts your body's normal functions, it can leave you in a constant state of exhaustion, accompanied by other troubling symptoms. But here's the catch: persistent fatigue is often brushed off as stress or being overworked. However, if you're feeling unusually tired for an extended period, it's crucial to consult with a doctor. They can run the necessary tests to identify if there's an underlying health issue that needs addressing. Cancer can appear in unexpected ways, which is why recognizing early warning signs can make all the difference. Your body has its own way of signaling when something's off, and it's important not to ignore those signals. Paying attention to symptoms early on could be the first step toward early detection and life-saving treatment. If you found this video helpful, don't forget to give it a thumbs up and share it with others. You never know who might need this information. Be sure to subscribe to Healthy Every Day for more expert-backed health insights that empower you to take control of your well-being. Your health is your greatest asset, and knowledge is your best defense. Stay informed, stay proactive, and take care of yourself. We'll see you in the next video. Until then, stay healthy and stay strong.